Greetings all. Today we will see new topic, that is the interceptive orthodontics. Okay. In previous lecture we have seen regarding the preventive orthodontics. Today we are going to see new topic, that is the interceptive orthodontics. Most of time in university exam we will get long answer question on this topic. Okay. So before starting the lecture, we'll see what is malocclusion. Actually, malocclusion is a deviation from accepted normal occlusion. It is considered as a malocclusion. Malocclusion generally we see in the three planes of space: anterior, posterior, vertical, as well as transverse. Generally, there is a malocclusion seen in the form of dental deformity, either on the dental deformity or the skeletal deformity. Generally, to treat this malocclusion, we do the certain procedure like the interceptive orthodontic procedure, preventive orthodontic procedures, then surgical procedures, and the fixed orthodontic procedure. But when we start this procedure at early age, generally we follow the preventive orthodontic procedure and interceptive orthodontic procedure. So, what is interceptive orthodontics? So, American Association of Orthodontics define interceptive orthodontics as that phase of science and art of orthodontics employed to recognize and eliminate potential irregularities and malposition in the developing dentofacial complex. So this we have to recognize and eliminate potential irregularities means malocclusion. We have to identify and eliminate that malocclusion when it is in the developing stage. So what is difference between preventive orthodontic and interceptive orthodontic? It is a time period. Generally, interceptive orthodontic procedure we are carried during early mid dentition when there is a malocclusion already is there. So interceptive orthodontic procedure generally we are carried out to prevent the malocclusion goes into the severe one. And preventive orthodontic procedure we are carried out when occlusion is normal, and in preventive orthodontic procedure we are preventing the onset of the malocclusion. So what are the different procedures are undertaken in interceptive orthodontic procedure? So these are the serial extraction, space regaining method, correction of developing crossbite, then control of abnormal oral habit, muscle exercise, then removal of the soft tissue or bony barrier to enable eruption of the teeth, and interception of the developing skeletal malocclusions like the skeletal class 2 and class 3 malocclusion. Among all these methods, the serial extraction, most of time you will get long answer question on the serial extraction procedure. So what is the serial extraction procedure? Before going forward, we'll see what is the history of serial extraction procedure. So in 1929, Tejal Grant used the term serial extraction. After followed by in 1940, Nance popularized this technique in USA as planned and progressive extraction. For this contribution, Nance is also considered as the father of the serial extraction. In 1970, Horst termed this procedure as the active supervision of the teeth by extraction. So what are the indications for the serial extraction? Generally, it is indicated in the class 1 patient with the class 1 malocclusion and the straight profile. Then, it is indicated when the arch length is deficiency more than 10 millimeter. Then third indication is the when there is growth is not enough to overcome the discrepancy between the tooth material and the basal growth. Generally, it is carried out in the class 1 malocclusion where the mesiobuccal cusp of the maxillary molar occlude with the buccal groove of the mandibular first molar. Okay. So what is arch length? Generally, arch length is the distance measured from the mesial aspect of the permanent first molar to the opposite permanent first molar. So what is the importance of this arch length? Generally, this arch length is developed when there is a early loss of the deciduous posterior teeth. Because of that, what happens? Teeth moves mesially, and there is a loss of arch length, which leads to the different orthodontic problem like the ectopic eruption of the teeth, crowding of the teeth, and impaction of the teeth, and there is also midline shift. So this is a small video. It is showing how there is a loss of arch length create the problem. Okay, we'll see this video. See, when there is early loss of deciduous posterior teeth, because of that what happens? There is a mesial migration of the permanent teeth, and because of that what happens? It prevents the proper eruption of the premolars and canines. So because of that, what happens? You can see here there is a ectopic eruption of the canine is there. Okay, one of the most common sequelae of this loss of arch length is the crowding. So loss of arch length leaves less space for the eruption of a permanent teeth, which may lead to the crowding. Crowding is the bunching of the teeth. Okay, so how this arch length deficiency is indicated? It is indicated by the premature loss of the deciduous canine. Also, there in arch length deficiency, there is a midline shift of mandibular incisor due to displaced lateral incisors. Then there is abnormal canine root resorption is there because of the abnormal path of eruption of the permanent teeth. Then there is a canine, there is chances of the canine being blocked out labially or lingually. Then there is a mandibular and maxillary anterior teeth that are procline. Because of that arch length deficiency, there is a proclination of the maxillary and mandibular anterior is there. So that proclination, both maxillary and mandibular anterior proclination, also known as the bimaxillary protrusion, and it could be associated with the crowding of the teeth. So serial extraction procedure cannot be carried or it is contraindicated in patients with the class 2 and class 3 malocclusion with the skeletal abnormality. Also, it is not carried out in the spacing dentition. It is also contraindicated in anodontia or allodontia where the tooth number is less. Also in patients with open bite and deep bite cases, also in midline diastema cases, it is contraindicated. Why? Because in serial extraction procedure, we are carried out the certain extraction of the posterior teeth. Because of that, there is a chances of deepening of the bite. So patient already is having deep bite, we are not going to do the serial extraction procedure. Then also patient with unerupted malformed teeth, example dilaceration. In that case also we are not doing the serial extraction procedure. So there are three different methods are there for the serial extractions. What are those? So Dewell's method, Twill's method and Nance method. So what is Dewell's method? It is a three-step serial extraction procedure where the extraction of the three teeth are carried out. Here at the age of the 8 to 9 years, there is a deciduous canine is extracted. So why we are removing the deciduous canine? To allow for the proper alignment of the anterior teeth. Followed by we do the extraction of the deciduous first molar a year later. Followed by the extraction of the erupting first premolar. So deciduous first molar we are extracting to allow for the proper eruption of the first premolar, followed by the extraction. Why we are doing the extraction of the first premolar? To allow the rapid eruption of the permanent canine. So sequence of the extraction in Dewell's method is the CD4. C stand for the deciduous canine, D stand for the deciduous first molar, and 4 stands for the first premolar. So this is here again a small video is showing the Dewell's Dewell method of the serial extraction. So in Dewell's method, first we do extraction of the deciduous canine. Because of that, what happens? There is a proper alignment of the anterior teeth takes place. After 1 year later, we do the extraction of deciduous first molar, which allows the proper eruption of the first premolar. Then after we do the extraction of the first premolar to allow the proper eruption and rapid eruption of the canine. If necessarily, we do the fixed orthodontic treatment for the correction of the axial inclination of the other teeth. Next method is the Tweed method. Tweed method and Nance method, they are the sequence of the extraction is similar. So what happens in Tweed's method? In this method, we do the extraction of the deciduous first molar around the age of the 8 years of age, followed by the extraction of the first molar and the deciduous canine simultaneously. So the sequence of the extraction here in Tweed's method is the D4C. D stands for the deciduous first molar, 4 stands for the first premolar, and the C stands for the deciduous canine. So in Dewell's method, the extraction sequence is CD4, and in Tweed's method and Nance method, the extraction sequence is the D4C. So what are the advantages of the serial extraction? As you know, this is the more physiological treatment as the teeth are guided into the normal occlusion position using the physiological forces. So what are the physiological forces? They are the vertical and type of the process. So by extracting the teeth at early age, we are guiding the permanent teeth into their proper position. Then duration of the fixed treatment is reduced as we are doing this treatment at early age. Also the results are more stable because we are halting the malocclusion at early age, so that the stability of the periodontal ligament is more good as compared to the when we do the extraction at the adult stage. But what are the different disadvantages of this serial extraction procedure? Patient cooperation is very important as we are doing this treatment at the early age. Mostly the patients are in their childhood stages. Then also there is tendency to develop tongue thrust habit because it is an extraction procedure. Patient might tends to put his or her tongue in between the extraction socket, and because of that what happens, there is a tongue thrust habit may get developed in patient. Then extraction of buccal teeth causing the deepening of the bite as we are removing the posterior teeth. So because of that the vertical dimensions of the mouth get reduced, and because of that what happens, there is a chances of deepening of the further bite. So I would like to conclude that this topic is summarized uh, interceptive procedure as a malocclusion, if detected as soon as possible, can be eliminated or made less severe by initiation of the interceptive orthodontic procedure. So we have to start this interceptive orthodontic procedure at early age to prevent the malocclusion goes into the severe. This is the bibliography of this chapter. Thank you.